Kurvelo is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Kurvelo may also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. The recommended daily dosage is 1 tablet at the same time every day. It is best to take Kurvelo with food or immediately after a meal to help prevent stomach upset. It's important to take Kurvelo exactly as prescribed by your doctor to maximize its effectiveness in preventing pregnancy. Before taking Kurvelo, make sure to read the patient information leaflet provided by your pharmacist. This contains important information on when to take your pills and what to do if you miss a dose. Take Kurvelo by mouth once daily at the same time each day. If you are taking the chewable tablet, follow the manufacturer's directions for your brand. It's important to continue taking this medication exactly as prescribed by your doctor. If you experience vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Taking Kurvelo after your evening meal or at bedtime may help with stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take 1 active pill once daily for 21 days in a row, followed by 7 days without taking any tablets unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. If this is the first time you are using Kurvelo and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. Use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you have any questions or if any information is unclear, consult the patient information leaflet or your doctor. Some common side effects of Kurvelo include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, and weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. However, it's important to monitor your blood pressure regularly, as Kurvelo may raise it. Be sure to seek medical attention if you experience any serious side effects, such as lumps in the breast, mood changes, severe abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin. In rare cases, Kurvelo may cause serious problems such as blood clots, so it's important to seek immediate medical help if you experience symptoms such as chest pain, confusion, sudden dizziness, or trouble speaking. While allergic reactions to this medication are rare, it's important to seek medical help if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of side effects, so be sure to contact your doctor or pharmacist if you experience any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you smoke cigarettes or use tobacco and are over 35 years old, you should not use Kurvelo. This is because smoking can increase your risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Kurvelo. The risk of these serious problems can increase with age and the amount of cigarettes you smoke. It is important to avoid smoking or using tobacco while taking Kurvelo. Before using Kurvelo, it's important to talk to your doctor or pharmacist about any allergies you may have to estrogens or progestins. This medication may also contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist. It's important to also inform your doctor or pharmacist about your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol, depression, diabetes, gallbladder problems, heart problems, kidney disease, liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, it's important to regularly check your blood sugar levels and notify your doctor if you experience symptoms of high blood sugar. If you have phenylketonuria, diabetes, or any other condition that requires you to limit or avoid sugar and/or aspartame, it's important to use caution with chewable tablets that may contain these substances. It's important to inform your doctor if you are planning to have surgery or will be confined to a bed or chair for a long time, as this can increase your risk of blood clots, especially when using hormonal birth control. Kurvelo may cause blotchy, dark areas on your face and skin, so it's important to limit your time in the sun and use sunscreen when outdoors. If you wear contact lenses, you may develop vision problems, so it's important to contact your eye doctor if you experience any issues. After stopping Kurvelo, it may take longer for you to become pregnant, so it's important to consult your doctor if you plan on becoming pregnant. This medication should not be used during pregnancy, and if you become pregnant while taking it, it's important to notify your doctor. Kurvelo may also decrease breast milk production, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Kurvelo works in your body. Some products that may interact with Kurvelo include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to be less effective, potentially leading to pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs, among others. If you start any new medication, make sure to inform your doctor and discuss whether you should use additional reliable birth control. It's also important to report any new spotting or breakthrough bleeding to your doctor, as these may be signs that your birth control is not working effectively. Furthermore, Kurvelo may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Kurvelo and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Kurvelo with others. While taking this medication, it's important to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. It's important to follow your doctor's instructions for examining your breasts and to report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose, refer to the product package information for advice on what to do. You may need to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, ask your doctor or pharmacist. If you often forget to take your pills as directed, contact your doctor to discuss switching to another form of birth control. It's important to store Kurvelo at room temperature, away from light and moisture. Make sure to keep it out of the bathroom, and away from children and pets. When it comes to getting rid of any unused or expired medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult with your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.